Brittany.
My name is Daniela.
And my name is Evelyn, and this is GSN.
Today we're going to be talking about the importance of nurses.
The two different types of nurses we'll be talking about is the pediatric nurse and gynecology nurse.
It takes a lot to be either one of these nurses, and today we're talking about the requirements that have to become these nurses.
Let's ask the people of our community their opinions about nurses.
Nurses help your community by taking your vision tests, your hearing tests, your blood pressure, and make sure that you stay healthy.
Nurses are important people. Not only do they offer health care, but they are very positive people that make kids feel good. Nurses take care of you when you're sick. Give us medicine and we stay healthy.
Establish relationships for healthy living, teach the community in taking care of family, encourage community to take care of themselves by going to monthly checkups.
Nurses are cool because they help us live longer and they give us shots so we don't get sick.
Nurses help our community because they help those in need. They so help us with taking care of our health.
You might be wondering what a pediatric gynecology nurse does.
Let's report to Janet Rios with the information about these nurses.
Thank you, Brittany. I'm Janet Rios, reporting live from Hollywood Medical Center. What we're going to first be talking about is a pediatric nurse. What a pediatric nurse does is work with patients from infancy to adulthood. They give treatments for common illnesses such as chickenpox, allergies, and diarrhea. They work very close with family doctors to provide care. As a nurse, you teach the patient's parents and family members on how to prevent these childhood diseases. And you also teach them about the proper nutrition for health and development. Now back to you, Brittany.
Thank you, Janet.
According to the U.S. Bureau of Labor Statistics, the annual salary for a pediatric nurse is $68,910 as of 2013.
For an oncology nurse, the salary is $46,132 to $90,142.
To become a pediatric nurse, there are many educational requirements. You need 4 different types of degrees. The first one is an associate or nursing diploma, which both takes 2 to 3 years to complete. The second one is a Bachelor's of Science in Nursing, which takes 4 years to complete. Third one is a Master's of Science in Nursing, which takes 2 years to complete. And finally is a PhD or DNP, which takes 2 to 4 years to complete. You also must become a licensed and registered nurse. In order to become a licensed nurse, you must pass the NCLEX-RN, which stands for National Council Licensing Examination for Registered Nurses.
For an oncology nurse, you must have an Associate of Science in Nursing, which takes 2 to 3 years, and a Bachelor's of Science in Nursing, which takes 4 years. You also must be a licensed registered nurse and pass the National Council Licensing Examinations of Registered Nurses. You must also have a certification from the Oncology Nursing Certification Corporation. When becoming a nurse, there are many responsibilities to it. For example, for an oncology nurse, their responsibilities are to review their patient's health history. They also assess their physical and emotional status. They are in charge of chemotherapy, and they also have to help their patients understand their diseases and the possible side effects.
For a pediatric nurse, they also have responsibilities. They have to conduct physicals, give child immunization, diagnose illnesses, screen illnesses if they have any, and prescribe medication. For a pediatric nurse, some skills that they need for their job is communication skills, organization skills, basic choice making, good hearing skills, and compassion.
Some skills for an oncology nurse are that they have to be patient-facing, meaning they have to be able to have a strong heart to tell their patients they have cancer, and they also have to be very research-orientated, meaning they have to do a lot of background research on their patients and the disease they have.
In order to become a pediatric nurse, you need to go through training. And the basic training that they get is how to work with kids, and they train their educational and clinical knowledge.
For an oncology nurse, the training that they get is they practice how to give